As a pharmacist, I'm here to share with you what supplements you should take during this process. So if I had to say, is there one vitamin that you can take? Yes, you can take a prenatal. If it's hard for you to take multiple vitamins, then go ahead and just take the prenatal. Otherwise, I'm going to take you step by step through the eyes of a pharmacist what all these vitamins are. So folic acid is also known as folate, and if you look on the back of your labels, it'll be known or it'll be indicated as vitamin B9. So why take folic acid? Well, studies have shown the folic acid is used to prevent neural tube defects and for your baby to have a proper development of their brain. All you have to do is make sure that the form of the folic acid has the word methyl or methylated in it. That way you're guaranteeing that your body will absorb as much as it possibly can. Vitamin B12, also known as cobalamin or cyanocobalamin. So typically when I have a patient that's tired, sluggish, I recommend a B12 because it helps with, concentration, helps their immune system, gets their metabolism going. So all in all, it has great benefits. But why would we take it if we want to freeze our eggs? Well, it actually helps your nervous system, helps your red blood cells, and your DNA. So the quality of the egg that will be retrieved will be much better if you're on a B12 supplement. So again, all you have to see is the word methyl B12 on the back of the label, and that's the one that you should be taking. So vitamin D3, also known as cholecalciferol or commonly known as the sunshine vitamin, it's actually shown to help regulate your ovulation and your menstrual cycles. So doctors typically they like for you to get started on this vitamin as well. The best way, if you can, is go get tested and see what your levels are. And then your doctor can either recommend an over-the-counter supplement, which typically you need about 2,000 to 4,000 international units a day. Or the doctor might say, hey, like he told me, why don't you go get a prescription for a few months just to make sure you get your levels where they need to be. So another supplement that we like to include during this process is something called CoQ10, which is also known as coenzyme 10. Honestly, all you need to know is that as we age, so does our quality of egg. I've definitely mentioned that tons of times, but also as we age, our mitochondria also decline in age. So what CoQ10 does is kind of give it a little boost to make sure that the mitochondria is functioning as well as it possibly can and giving our body the energy to do whatever it is. And so in this case, we need that energy to create a good egg, but it's a little tricky because CoQ10 comes in two different forms. One is called ubiquinone, which over the counter you'll find it all over the place, and it's a little cheaper than the other form, which is called ubiquinol. Now, ubiquinol absorbs much better, and you're gonna have to pay a little bit more for it, but honestly, if you're doing it, you're gonna do it right. DHEA. DHEA is known as dihydroepi. Look, I'm a pharmacist and I can't say what the hell the word is. Just let's go with DHEA, it's much better. This is a naturally existing hormone in the female body. It converts both the male and female hormone into testosterone and estrogen. So women that are recommended to take this particular supplement are those which, like myself, are a little bit older, so our egg quality is not as good, or are those women that are considered premature ovarian aging. So what that means is how old you are does not correspond to the age of your ovaries. I know that sounds really weird, right? So basically, let's say I was 20, but my ovaries are acting or looking like they were 30. So the other group of women that would be a good candidate for taking the supplement is those with diminished ovarian reserve, meaning they don't have a lot of follicles. So doctors recommend the DHEA because it helps reduce the amount of abnormalities. And if a woman has an abnormal egg, or better yet, if they have chromosomes are abnormal, they're more likely to result with a miscarriage. So we're not ready to get pregnant, right? But we are freezing our eggs. So we have to make sure that we do whatever we can to improve the quality of our eggs. Now, as a pharmacist, I can tell you there are tons of prenatals out there, but I like this company that I chose. It's called, the name of the prenatal is called Prenate Mini. They have tons of other options, but what I liked about this company was that they allowed me to answer a questionnaire on their website, and they chose one of their prenatals based on my answers. So basically they tailored it to my needs, and I thought it was amazing. And they have a coupon, so I only paid $20 for this brand name prenatal, and I like it because it's gluten-free, lactose-free, sugar-free, so I'm not putting any extra fillers into my body, and I'm all about that. So when you pick a prenatal, you want to make sure first and foremost that it has your folic acid. You want things like iodine in it to make sure that your thyroid is functioning appropriately. You want iron to support your blood cells. You want vitamin A, C, E. Those are antioxidants. And honestly, it's flu season, and I even add an extra vitamin C to my daily tablets just because I want to protect myself and keep my immune system as strong as possible. And again, the B vitamins like we talked about, B9, which is folic acid, B12, make sure that's in it. You also want to see, it would be nice if your prenatal had fish oil. So things like, it's commonly known as EPA or DHEA. Fish oil will support the egg quantity, and it also reduces inflammation, which is amazing. And then you want things like selenium and zinc, which have antioxidant effects. I can tell you, I make sure to take mine in the morning, but I also know that if I'm not having breakfast at home, which happens a lot, I'll make a little Ziploc bag, put it in my purse, maybe have it after lunch. I typically don't like having it after dinner because some of the vitamins will give me a little bit of energy and it'll be harder for me to sleep. So, form a habit. Do it after breakfast. As soon as you're done and you're cleaning up your dishes, just pop your vitamins and you don't have to worry about it.